Welcome to Logic Medico, where we are understanding concepts in medicine. Today's interesting topic is deep perineal pouch. It is a very simple topic actually. This deep perineal pouch, all that we have to draw is one diagram understanding the orientation of the deep perineal pouch. So this is the pubic symphysis area, okay, and here I will show you the istiopubic ramus. This is the ischium, and here I can show you obturator foramen. All that you have to understand is in the deep perineal pouch location. See, it is located above this membrane called perineal membrane. So here will be the superficial perineal pouch. This area is superficial perineal pouch. This area is deep perineal pouch. So this deep perineal pouch is located above this membrane called perineal membrane, depicted in a triangular fashion. Structures piercing it is mentioned here. So all these structures, when they are piercing this perineal membrane, so they have to pass through deep perineal pouch. I will tell you that in a much simpler way over here with a line diagram. So here we have the deep perineal membrane actually. Here we have the superior fascia of urogenital diaphragm, and here we have a perineal body. The perineal body, and here we have the Cooley's fascia, the deep fascia of the perineum, and then we have the scrotum, and then the Buck's fascia of the penis. Okay. So this space over here is a superficial perineal space, the superficial perineal pouch. This space over here is the deep perineal pouch. The only other name I request you guys to remember is the other name of the deep perineal pouch is also called as urogenital diaphragm. If you understand this, then everything becomes easy. So please remember the other name of the deep perineal pouch is UGD, urogenital diaphragm. For what is this urogenital diaphragm? We don't know anything. Okay. So if you tell like that, here is the sacrum and the two hip bones together form the bony pelvis. Okay. At the pelvic outlet, we have a diamond shape area. This diamond shape area is bridged by this diaphragm called as pelvic diaphragm. Anteriorly, this pelvic diaphragm has got a triangular gap just behind the pubic symphysis. Okay, just behind the pubic symphysis, we have a triangular gap or a hiatus. We call it as urogenital hiatus. So this urogenital hiatus, within this gap passes the urethra and the vagina. So urethra belongs to urinary system, right? And vagina belongs to genital system, right? In male there is only urethra, but it is a common passage for both sperm and urine. So we have the urethra, we have the vagina. So therefore it's called urogenital hiatus. This urogenital hiatus is bridged by a separate diaphragm, and that diaphragm is called as urogenital diaphragm. I'll repeat one more time. The pelvic diaphragm, which is bridging the pelvic outlet, supporting the pelvic organs, will have a gap in the anterior plane. That gap is also called as hiatus, urogenital hiatus. So in this gap, this urethra and vagina will pass in female. In male, only urethra will pass. But this gap cannot remain as a gap, otherwise hernia of these organs will happen. So from below, from below, we have a separate diaphragm below the pelvic diaphragm in anterior plane. It's called the urogenital diaphragm. The other name of the urogenital diaphragm is deep perineal pouch, because starting from perineum, if you want to approach that, first I'll get this space which is superficial, and then I'll get this space which is deep. Therefore it's called deep perineal pouch. With this understanding, we move on to the boundaries of the deep perineal pouch. It's very simple. I have already shown that, but I want you to understand and repeat after me. This anteriorly to the posterior surface of pubic symphysis. Posteriorly, it is the perineal body in the midline. Superiorly, it's a superior fascia of urogenital diaphragm. Inferiorly, it is the inferior fascia of urogenital diaphragm. On either side, this is the ischium, the black color of bone I'm talking here, and this one is the pubis. On either side, it is istiopubic ramus. What are the boundaries? Anteriorly, posteriorly, superiorly, inferiorly, and on either side. So if you're able to repeat that once more, and it will be over. Anteriorly, pubic symphysis. Posteriorly, perineal body and the two fascias become continuous with one another. Superiorly, superior fascia of UGD. Inferiorly, inferior fascia of UGD. So easy it is. Inferiorly, inferior fascia of UGD. And on either side, ischiopubic ramus. If you tell that urogenous, this last point is very important for these boundaries. Moving on to the contents, see, since urethra is passing through this, we can see that here also, since urethra is passing through this, so there will be a muscle surrounding the urethra like this. I will just show you diagrammatically. You don't have to show all this diagram. One diagram like this is good enough actually, for a 5 marks. So the urethra will be surrounded by a muscle like this in a spherical fashion. That muscle name is sphincter urethra. So this muscle name is sphincter urethra. So definitely sphincter urethra is a content of deep perineal pouch. Other muscle is transversely oriented like this, transversely oriented, and it is present in deep pouch, right? So this muscle is called as, this muscle is attaching from the perineal body side to the inner surface of the ischial tuberosity, this area. I am showing you this aspect, the lower aspect of pubic symphysis, this one. So this muscle name will be deep transverse perineum. Deep transverse perineum. So when I show the muscle, obviously the muscular branches supplying this will be there. So that's why I've written this diagram. Muscular branch. I don't want to scare you with this diagram, but what I want to tell you is there are two major muscles in this deep perineal pouch. One is sphincter urethrae, and the other one is deep transverse perineum. Sphincter urethrae helps in emptying the last few drops of urine. Deep transverse perineum stabilizes the perineal body. Okay, this is the perineal body. When two muscles are there, the two muscular branches will also come in. In addition to this, all these structures, whatever is piercing. So when the duct of bulbourethral gland is piercing, that means we have a gland here only in male. The gland name is bulbourethral gland. This gland produces mucus which lubricates the, it will finally end up in the urethra. This gland, not here but in the superficial perineal pouch. But we have the bulbourethral gland present here. Bulbourethral gland, it's important, it's present only in male. It produces mucus which lubricates the female genital tract and helps in before mating. Okay. So this is about the muscle, gland, and the blood vessel already listed over here. Dorsal artery of penis, deep artery of penis, urethral artery, artery to the bulb of the penis, posterior scrotal arteries. So all these blood vessels and nerves which are piercing the perineal membrane, which is nothing but the perineal membrane is nothing but the inferior fascia of UGD, inferior fascia of urogenital diaphragm. So it's piercing that, obviously that means it is passing through the deep perineal pouch, then only it can pierce and come into the superficial perineal pouch. It has to pass through this. I'll just show you one simple thing. So one artery will show you, see, like this, it has to pass, then only it can come over here, right? So as simple as that. So it is a content of deep, it is a content of superficial perineal pouch also. Okay. So to summarize, the deep perineal pouch is also called as urogenital diaphragm. It is present at the gap called the urogenital hiatus. This gap is present at the outlet, pelvic outlet, where it's bridged by pelvic diaphragm. So where the urethral and vaginal orifice are going in female and urethral orifice in male. The boundaries of this, to summarize: anteriorly pubic symphysis, posteriorly perineal body and the two fascias continuing with one another across this like this, and superiorly superior fascia of UGD, inferiorly inferior fascia of UGD. On either side the bone is ischiopubic ramus. So this space is closed on all sides. Okay. So what happens if at all there is a rupture of the urethra at this plane? If at all the urethra breaks open at this plane, this urethra is traveling through this, right? I'm showing it here, please observe. The urethra ruptures here, the urine percolates through the deep perineal pouch, it can't expand anywhere. So the patient will have severe excruciating pain. If at all this urethra is ruptured, the patient will have severe pain because the urethra is ruptured, because there is no gap here similar to the superficial perineal pouch. Unlike the superficial perineal pouch, where the scrotal swelling, penile swelling, anterior abdominal swelling can happen because the pouch is open anteriorly. Superficial perineal pouch I'm talking, okay? Here the pouch is closed on all directions. Hence it can't expand and therefore it is extremely painful. Okay? Then boundaries over clinical importance over contents, mainly the muscle sphincter urethrae and the deep transverse perineal muscle and the bulbourethral gland. Major contents. Other contents include the artery, dorsal artery of penis, deep artery of penis, urethral artery, artery to the bulb of the penis. Okay, on the posterior scrotal arteries. All these are also the contents. Thank you for watching and learning from Logic Medico. If you're new to our channel, kindly consider subscribing and don't forget to like this video and share this video with your other friends. Thank you for coming to Logic Medico. Thank you once again. Bye. See you next time.